Good morning, friends. Hope I'm audible now. Very sorry. Welcome to our second OBFET webinar in connection with RAK biggest weight loss challenge. One of the biggest challenges faced today globally is obesity and being overweight, which is the largely contribution of overeating and sedentary lifestyle, which leads to various metabolic diseases such as diabetes, hyperlipidemia, heart issues, joint ailments. Thus, obesity is also known as mother of all chronic diseases. WHO has listed obesity as a major health concern. Today, our OBFET topic is obesity and its clinical management. Our esteemed speaker, who is an eminent endocrinologist, Dr. Hala Hamdy, will speak about the impacts and solution for the obesity. Dr. Hala works at RAK Hospital as HOD endocrinology with over 30 years of clinical experience. She did her master's in 1987 and got MRCP in 1999. Her experience is very vast. To name few, which includes comprehensive patient care with diabetes and associated endocrine disorders. She helps diabetic women with pre-conception care and managing gestational diabetes. Other than that, thyroid problems, polycystic ovarian disease, the list is much more. Without delay, it's my pleasure to invite Dr. Hala to present her session. Dr. Hala.
Thank you, Dr. Rico, very much for this visit. Hello, everyone. We'll talk today about obesity and its clinical management. Obesity is a complex issue, and we will speak today to understand what is obesity, what is its causes, and what is its complications, and how to manage it. And this is a bit a difficult issue. Can we make it slide? Okay, thank you. So what is obesity? How can we define it? Obesity, its definition is overweight and obesity are both defined as abnormal or excessive fat accumulation that presents a risk to the health. The issue has grown to epidemic proportions, with over 4 million people dying each year as a result of being overweight or obese in 2017, according to the Global Burden of Disease. So obesity now is considered as a disease. So how can we assess whether you are obese, overweight, or normal weight? We have what is called the body mass index. The body mass index doesn't measure the body fat directly, but it is as a risk indicator of the disease and at the degree of obesity. Body mass index is measured at the person weight in kilogram divided by the square of height in meters. And accordingly, we can know whether the patient is normal weight, which is from 18.5 to 24.9, or obese, which is more than 30, or overweight from 25 to 29.9. And also, the obesity itself is classified to 3 classes: 30 to 34.9, the class 1, class 2 obesity, 35 to 39.9, and morbid obesity or severe obesity, which is more than 40. So what are the causes of obesity? Overeating with lack of exercise, genetics, maybe medications, maybe diseases, the family history. All these are factors which will deal with it today. So poor diet. Obesity doesn't happen overnight. It develops gradually over time as a result of poor diet. What we mean by poor diet? Eating large amount of processed food and fast food, high in fat and sugar, eating large portions that you need. So it is the amount and the quality of the food which you eat, drinking too many sugary drinks, and the comfort eating, as having stress or depression, you eat to make yourself feel better. All these poor diet with lack of exercise, obesity happens. Genetics, rare genetic conditions in childhood obesity as Prader-Willi syndrome. It may be true that there is some genetic traits can be inherited, such as having large appetite, which makes losing weight more difficult, but it certainly does not make it impossible. Obesity is more to do with the environmental factors, such as poor eating habits during childhood. So when we treat obesity, we need an endocrinologist, a nutritionist, and a psychotherapy also to change these behavioral changes. And parents are encouraged to notice what their children are eating to improve their habits in eating. When a patient comes complaining of this obesity, we have to rule out what drugs he is taking, as some drugs may cause more weight gain, as corticosteroids, sulfonylureas in diabetes mellitus, some epilepsy medication, some antipsychotics, as in schizophrenia. Also, we should rule out hypothyroid or underactive thyroid gland, where the thyroid gland doesn't produce thyroxine, or Cushing's syndrome, which is a rare disease that causes overproduction of a steroid hormone. We have to rule out these conditions before seeing what we'll do with obesity. Everyone come to my clinic asking about the problem of his obesity, telling me, test the hormonal imbalance. Yes, there is hormonal imbalance occurring in obesity. The neurobiological mechanisms are reported to contribute to eating in the absence of energy demand and hunger. So you are not hungry and still you want to eat more. You don't feel satiety. There are hormones which helps you to feel not hungry and others which feels you are hungry. So the gut hormones play the most critical role in obesity. The cells of the GIT sense the ingested food, release gut hormones that regulate energy and the glucose homeostasis. The glucagon-like peptide 1 peptide and the oxyntomodulin signal the availability of nutrients to the brain and suppress the appetite. While the leptin, which is secreted by the adipose tissue, and especially the visceral adipose tissue, acts as a signal for energy availability and also promotes satiety. And if there is no food, ghrelin is secreted and sensitizes the brain to the intake of the food. So high calorie intake leads to the adipocytes, which are the fat cells in the body. They hypertrophies, increase in size, increase in number, and reduce blood supply to adipose tissue and causing hypoxia. Macrophages infiltration occurs, leading to localized inflammation and overall systemic inflammation. So now we see here in a normal person what happens. We have, as we said, gut hormones release when the food comes in and induce that you are not hungry. Also from the adiposity, signals from the fat cells secrete the leptin, which also helps to feel you that you are not hungry. And if you are no food, then another hormone called the ghrelin reach the hypothalamus and induce the hunger pains. So what happens in obesity? All concerned by the leptin. So either genetic mutation for the leptin, and this happens in obesity, sometimes obesity in childhood, or changes in the transports across the blood-brain barrier. So in obesity, we have what we call the leptin resistance. As we said, leptin is an adipokine. It reflects at the level of the brain the degree of adiposity of an organism. So in obese people, this hormone, this adipokine increase as we are expecting. But what happens? It doesn't reach the hypothalamus. Why? Because there is the blood-brain barrier. It becomes, as the leptin increases, the blood-brain barrier stops the leptin from reaching the brain, thereby leading to reduced activation of the signaling pathway. And they found in the mice, the obese mice, when they give the leptin by the intracerebroventricular system, they found it works, but not subcutaneous or intraperitoneal, or in the administration of leptin, indicating that the lack of leptin is due to 35% decrease in the blood-brain barrier permeability. And up till now, we don't have any treatment for this leptin resistance. Obesity, the most common risk factor of metabolic syndrome. And metabolic syndrome signals is the waist circumference. So obesity and the waist circumference are both puts you at the risk of type 2 diabetes, heart disease, heart attack, or stroke. How we measure this waist circumference? This is considered if it is more than 40 inches in males or more than 35 inches in female, considering that you have a wide waist. So the waist circumference and the BMI of the body, which is the body mass index, predicts your risk of diseases. People with obesity has many complications: a stroke, congestive heart failure, 51% hypertension, 21% myocardial infarction, 8% ischemic heart disease. So there is a lot of complications with obesity. If we get a normal person weight and an obese person, both have no dyslipidemia, no hypertension, no type 2 diabetes. We find in the obese people, which the BMI is more than 30, 49% increase the risk of coronary heart disease, 96% increased risk of heart failure, and 7% increased risk of cerebrovascular disease. Also, the liver is affected in obesity. First, it's causing simple steatosis, then 10% will lead to NASH, which is the non-alcoholic fatty liver hepatitis, and then 8 to 26% leading to cirrhosis. And of course, cirrhosis is one of the risk factors for hepatocellular carcinoma. All this causing by the fatty acid, free fatty acid increases, and also the tumor necrosis factor causing this inflammation in the liver. Being overweight or obese is the main modifiable risk factor for type 2 diabetes. So we can cure type 2 diabetes if you lost weight. as BMI increase, so that the risk of type 2. And people with severe obesity are particularly at risk of type 2 diabetes. And if even you don't have a family history of diabetes and you are obese, it is recommended that you screen for type 2 diabetes. Having a large waist circumference increases the likelihood of developing type 2 diabetes. Obesity is a risk factor for several chronic diseases, most notably hypertension, type 2 diabetes, dyslipidemia, and chronic heart disease. In addition, obesity has been shown to constitute a risk factor for colon cancer, postmenopausal breast cancer, endometrial cancer, renal cell cancer, as well as adenocarcinoma of the esophagus. So obesity can cause, as we said, liver disease, fatty liver, and even cirrhosis, hypertension, type 2 diabetes, dyslipidemia, cancer risk, mood disorders. Patients with obesity are often depressed, low esteem, heart disease, and reproductive disorders. For ladies, they have polycystic ovary syndromes with hirsutism, acne, and infertility disorders. Also for males, they have central hypogonadism with low testosterone. So how can we manage it? The goal of therapy for obesity is to broadly prevent, treat, or reverse its complications. Initial weight loss treatments focus on lifestyle interventions, including healthful nutrition, increase the physical activity, and behavioral modification. So it must be a team for endocrinology, nutritionist, psychotherapy to treat all these modifications. Also, individuals not achieving the desired weight loss, medications are often considered before more invasive weight loss techniques are considered. Up to now, the anti-obesity medications are not covered by the insurance, and this is a great problem for us. They should consider obesity as a disease, and they should allow us to prescribe and cover it. The weight loss is very important. You can imagine that 3% to 5% weight loss improves blood pressure, lipids, glycemic control, and liver steatosis. 9 to 10% weight loss improves the liver necrosis and inflammation, while more than 10% decrease the cardiovascular risk and a variety of inflammatory conditions. So how can we measure and treat? First, we have to rule out and see if there is any complications of this obesity, as a metabolic syndrome, prediabetes, type 2, hypertension, cardiovascular disease, fatty liver, polycystic ovary, infertility, hypogonadism in males, obstructive sleep apnea, asthma, osteoarthritis, urinary stress incontinence, gastroesophageal reflux, mental depression. All these are complications from the obesity. And then we see the BMI. So if the BMI is 30, more than 30, and this is an obese, first-class obesity, and the patient has no complications, so style life modification will be started and tried. But if still the patient is still gaining weight, then anti-obesity medications may be started. But if the patient is more than 27 only, that is overweight, but with complications and severe complications, then anti-obesity medication is considered. If the patient is second degree, then pharmacotherapy is also indicated. And if not giving good result, then bariatric surgery is the last resort. So what are the medicine or the anti-obesity medication for long-term use? because usually we give the medicine for 3 months, and then we assess the weight with the maximum dose, it should be less than 10% weight loss, 5 to 10%. If it is gaining this, then we'll complete till 6 months and maybe more. So we have tablets and we have injections. We have the Orlistat. It is an intestinal lipase inhibitor with reduced fat absorption by about 30%, but it causes side effects, of course, as loose stools or fecal incontinence and oily stools. We have the phentermine topiramate and decreased appetite and the binge eating behaviors. Also, we have the Contrav, which is a combination of the dopamine and norepinephrine reuptake inhibitor and opioid receptor antagonist. It decreases appetite and cravings, but also it causes nausea, insomnia, constipation. And then we come to the injections as liraglutide, which is called the Saxenda, 3 milligram. It is a glucagon-like peptide receptor. It decreases the appetite, increases the fullness, and increases the satiety. But of course, also has side effects as nausea, sometimes vomiting, sometimes abdominal pains. And the most recent is the semaglutide in 2.4 milligram. And this is taken once weekly. It is not yet here in the UAE. It is called the Wegovy, and it's the best, losing more weight. And still, it is a glucagon-like 1 receptor agonist, decrease the appetite and increase the fullness and increase the satiety. But with this medicine, without the style life modification, will not work. We have to combine both of them. The last resort is the bariatric surgery. Bariatric surgery procedures include gastric bypass, sleeve gastrectomy, which is the most common, gastric band, duodenal switch, and these operations have proven results in treating class 3 obesity. They also help normalize metabolism, blood sugar, blood pressure, and cholesterol. But before doing it, still we need the psychosocial help, because if the patient do the operation and then later on he starts his bad habits with high sugary, still he will gain again the weight. So this will not be the end of the story. Then now, even they changed the selection of the patients. The American Society of the Metabolism and the Bariatric Surgery and the International Federation for Surgery of Obesity guidelines now recommend metabolic and bariatric surgery for individuals with a BMI of 34 or more. Before it was 40, now becomes 35 or more, regardless of the presence, absence, or severity of obesity-related condition without any complications. And it be considered for people with a BMI more than 30 and metabolic disease. Before it was 35 with the metabolic, so they reduce the risk. The types of the bariatric surgery, we have many types, as we said. The vertical sleeve gastrectomy, the bypass, and according to the surgeon opinion. We have the gastric balloon, which is put the balloon for 6 months and then remove, trying to help the patient feel fullness and to reduce his weight. So what is the recommendations? Recommendation is to screen adults for obesity, offer or refer patients with a body mass index of 30 kilogram per meter square or greater to the intensive multi-component behavioral interventions. Screen children 6 years and older for obesity. Now, children obesity is very common for the bad habits of the food, and offer or refer them to comprehensive, intensive behavioral interventions to promote improvement in the weight status. 5% to 10% weight loss can reduce the risk of heart disease, as we said, and diabetes, and should be encouraged for all patients who are overweight and obese. Consider pharmacotherapy in adults who have not been able to lose weight through diet and physical activity alone, and who have BMI of 30 kilogram per meter square or older, or 27 with and obesity-related comorbidity, as we said. Bariatric surgery in adults who have not been able to lose weight through diet, physical activity alone, and who have a BMI of 40 or greater. Now the new recommendation 35, and the BMI of 35, now the new recommendation is 30, and obesity-related comorbidity. Regardless of body weight or weight loss, all patients should be encouraged to be physically active for improved health and weight maintenance. Regular physical activity related to maintaining normal weight, exercise also help health damaging effects to reduce of obesity, even without weight loss. Even if you don't get weight loss and you improve exercise, improve your insulin sensitivity and will improve your condition. That's all we can say today about obesity. Thank you.
Thank you, Dr. Hala. It was wonderful presentation. I hope audience has now more clarity on obesity and in impact on the health and the solution you give. You have spoken about many things like medical intervention, but you have also clarified if a person goes for any medical intervention, they should not be doing it by themselves. The doctor has to do it properly under the medical guidance.
Yes,
And
because
yeah,
because there are some limitations on the use. If the patient has some problems, we shouldn't give him this medicine.
true, true. So, Doc, that's the reason we have received many queries through emails and WhatsApp also, which shows the serious concern people have towards their health. Many have many concerns. They are asking whether we can go to pharmacy and get this fat burners and other things. So, let's start taking the queries. So, I have few queries with me. Let's see if people are asking. Please put on your chat if you find any question. Meanwhile, I will start taking the questions. One sec. Yeah, Mr. I'll take the chat first. Amit Mishra is asking, is taking medicines like fat burners, that was I was going to ask about, hunger depressant, are good for health? People, because people, we find people are going OTC and getting it from the pharmacy. So is it good?
See, we cannot give medicines without FDA approval. So these medicines are not FDA approved. So we cannot advise. The only medicine which FDA approved and should be taken under the advice of the doctor.
True, true, true. Vaishakha is asking for PCOD. I want to know that if you are getting periods early by 8 days, does it mean you have PCOD? This is completely a separate issue. It's a gynecological thing, but Dr.
No,
Hala,
it is
being
not
an
related.
endocrinologist,
No,
it's not related.
the polycystic ovary syndrome, it is a multi syndrome which affects it. So you have to have two of the three cardinal features. So either hyperandrogenism, we mean by hirsutism and acne, with blood tests showing the hyperandrogenemia, or the patient have amenorrhea or irregular periods. And the third is by ultrasound to find the ovaries, how much they are and the sizes. So two of these three, which is called the Rotterdam classification, is considered to be the polycystic ovary. It is not related to when your period starts, no.
Yeah, true, true. Third, Sujita is asking, individuals with the thyroid problems find it difficult to lose weight. What can we do?
If she have a thyroid problem and she is taking her medication regularly, and so her controlled TSH is normal, so why shouldn't we? She can lose the weight. This is not related. If it is uncontrolled, yes, and it is in hypothyroid state, then this will be hindered to lose weight. But as long as she is taking the medicine and TSH is well controlled, of course she can lose the weight.
True. Akila is asking, it's I think she has not given the complete statement, but is nerve compressing connected with obesity? I don't understand what she is asking. Maybe she's having some nerve pain and she's obese, so that's why she's trying to connect it.
Okay.
So, is nerve compressing connected to obesity?
Yes, we have, of course, we have something called the carpal tunnel syndrome. It happens that the obesity, because it will be compressing from the fats. It happens in pregnancy, the carpal tunnel, in obesity, and even in hypothyroid. But it happens. It is nerve entrapment from the obesity.
Yeah, true. The overburden for the musculoskeletal system and the nerves will create that. Okay, that's a good idea. Zaid is asking, my mother is pre-diabetic and has thyroid problems as well. She is given metformin 500 twice a day. What would be the best way to lose her weight?
As we said, there are steps.
Mm-hmm.
The food, the exercise is the best to lose the weight. If not, and how much her BMI is, then maybe we'll add another medicine to lose her weight. And if she lost weight, her sugar will improve a lot.
Yes, ma'am. Vaishaka is again asking, again with the connection with the PCOD. With PCOD and thyroid problem, is it okay to do 16 to 8 hours of intermittent fasting?
I cannot hear you, please, again.
Yeah. Vaishaka is asking, with PCOD and thyroid problem, is it okay to do 16 hours of intermittent fasting?
Yeah, nothing. It's okay. Intermittent fasting decrease your insulin in the body. So it will improve your polycystic ovaries, because the polycystic ovary, there is hyperinsulinemia. So it will improve the condition.
Yeah. One gentleman, I don't know the name, having uric acid 10.2, too much of leg pain, cannot go for a walk or exercise. What can we do? We have received many questions.
There is a joint pains, because of that he cannot work. Yani he cannot work because of the joint pains.
Yeah, that's what he's saying. Cannot work for exercise because of the leg pain.
Okay, so it is he can reduce his food, take healthy food. And there are some exercises which will not affect, yani if walking is painful for him, then swimming wouldn't be. He can use his hands if the legs are the problem. There are many options.
Yeah, true, doc. Swimming is one of the best options, or otherwise, now many advanced gyms are having hydrotherapy also, so they can do.
Yeah, this is very good. Yes,
exercise.
hydrotherapy. Right, you're right.
And one question, Shagupta Masood, she's asking, she is, I think she's a bit confused. Intermittent fasting or fasting, which is more good? And if she wants to, what she can do? Intermittent fasting or fasting?
What she mean by fasting? The intermittent fasting, we mean that she
Regular
will eat
fasting.
later. Yeah, it is the same. But
yeah.
But the intermittent fasting, that she can drink fluids, water, and so on. Okay, complete fasting, like in Ramadan, we don't drink the water, so it is dry fasting. But the intermittent is wet fasting.
True. Chandrasekhar is asking, I can see green nerves visible on my legs. It's like 1 inch in size, irregular in distribution, what it could be. I think he is confused. It's not nerves, it's the veins.
It is
and
varicose.
It may be varicose. Yeah.
Yeah.
So, yes, ma'am.
Yes, of course, varicose veins also increase in obesity, but he should see a vascular surgeon to see what he can do with it.
True. Now I'll be taking few other questions which we generally come across, and during the first day of the event, we even previous RAK loss challenge also we found this. What about HCG injections? People are taking it for fat loss. Is it safe?
What?
Many
Again?
gyms are HCG, the human cortical So they are giving HCG injections in the gyms also. They are suggesting to take HCG injections to lose fat.
ACT injection?
Yeah,
What is this?
HCG. Human
It's like,
gonadotropin. Yeah,
no, this is of course not good because it
it's not good.
suppresses the hormones in the body. It will have
Yeah.
later problems with him.
Yeah, yeah. One more question. Let me. Yeah. People think liposuction is very easy way to lose the fat. And what is the benefit? While who is suggested to go for a liposuction? Is there any difference between liposuction and bariatric surgery? You have already mentioned about bariatric surgery, but people think liposuction is easy to lose weight. Many wellness centers are promoting this.
You see, the liposuction didn't prove to improve the related complications. Okay, the liposuction didn't prove but the bariatric surgery, the glucagon-like peptides are improving and the incretins are improving and the metabolic of the metabolism of the body is improving. But the liposuction, it doesn't prove any benefit from the metabolically point of view.
Yeah, true. There is one question he has asked, Mr. Joseph. I'm diabetic and is on insulin, and his BMI is 33.5, and he has hypertension also. Is it injurious to do exercise?
Yes, of course, he can do the exercise, but before doing the exercise, he should measure his blood sugar to be sure that he is not hypoglycemic. And also after half an hour, he should measure the sugar to avoid hypoglycemia.
Yeah, he's always should safe side to keep some candies or juice whenever he feels any drowsiness and any discomfort.
Even in some exercises, the blood sugar increases up. It's according to what exercise you are doing.
True. So you have to go for a fitness coach to assess what exactly your health status is and what exercise you should be doing. Pitya is asking about the growth hormones. Is affecting the health and the body improvement?
It is not indicated.
Growth hormone?
Yeah, growth hormone is not indicated to be given unless in children with proven growth hormone deficiency or in adults with a panhypopituitarism and many hormones, and that we prove that it is low growth hormone. Otherwise, it is not indicated for good health.
True. Naval is asking, I wanted to know, I have started exercise since 2 weeks. At first, I lost 3 kilos, but second week, 2 kilos only with the same diet and same exercise. So, Doc, with your permission, I will like to answer this.
So we cannot assess only in 2 weeks. He should continue on at least 3 months and then we'll see the results. Dr. Vico? Hello? I cannot hear you.
Yes, ma'am. Sorry, I got disconnected. So,
okay. Dr. Vico?
Yes, ma'am. Can you hear me?
Yeah, I can hear you.
1 second. My system.
Yeah. Hello? Yes, you can hear me?
Okay. Yeah, we can. Overall, if we say, what do you suggest for the weight loss? Like you have already mentioned, not only taking any help for the medical management, lifestyle is also important, and you have to modify your lifestyle. And you have also mentioned about during the bariatric surgery that doing bariatric surgery is not only the last solution. This is not the end. You have to maintain it. You have to maintain your diet for maintaining the whatever you have lost to maintain it. Otherwise, again,
Yeah.
you will gain a weight. So your last recommendation, what should be considered for an ongoing medical management or lifestyle management for the obesity? What should we do?
It's as we said, it's according to the BMI. Okay, and after 3 months of severe life modification and weight, we see how much weight loss we are. We lost 3 to 5%, that is good, then continue on. If you didn't lose weight or you gain weight, then we have two other modification as anti-obesity medications, and we follow with our weight and with the exercise and with the food. Then some people, they are morbid obesity, the BMI more than 45. So if they are losing, that's good, but usually it will not be able to be lost unless we add either medications or surgery.
Yeah,
It's according to the BMI and whether there are complications or not, to protect the patient from the complications.
True. Vijesh is asking, you have spoken about the balloon therapy. We have non-invasive swallow balloon weight loss promoted by many clinics. Is it doing any good? You have already mentioned about this. So answer this, ma'am.
It doesn't need a high BMI. يعني the BMI will be 27 to 30, 32 like this. Okay, it may help, but I didn't see very good results with it.
That's only, you can say it's only a temporary.
Temporary for 6 months, that she is adapting the new lifestyle and the little weight, the little food, and then she will continue on. But usually it doesn't give very good results.
True. I have already asked this question, and Naval is again asking the same. Does losing weight gets harder by time? True. That's what I mentioned, Naval. Because once you do any weight loss program, it comes to you will in the starting you will get a good result. Then it goes to a plateau. Then the benefit reduces. You will not find any much weight loss. So you have to work little harder to break that stagnation.
It should be for life, because otherwise you will have the yo-yo. You know, the yo-yo, it comes and comes up and down. It's very difficult. It is a very difficult task to lose weight. It's not an easy task.
That's true. That's what we generally used to say. Losing weight is hard. Maintaining the lost weight is much harder.
You are right.
One last question I will be taking. Yeah, this is again about the person is having knee or osteoarthritis of knee, right knee, and he is asking what would be the best way to do exercise. You have already mentioned about the swimming and the
hydrotherapy, right? Yeah.
I think these are the questions we have already covered.
But I want to add something, that exercise is important, yes, but the food is the main thing. Changing the habits, changing the amount they are eating, and know what, before putting the food, think what it contains.
True. I think this will be now we have already covered all the questions, and if anyone has some queries still pending, so they can send an email at support@RAK Weight Loss Challenge. We'll be happy to guide them. Okay, one last question I will take, ma'am, with your permission. Mr. Chandrasekharan is asking, I'm allergic to milk product. Which food is good for be good probiotic with other than the milk product? I think this will be the best answer given by our dietitian. The next session will be diet and obesity. There you will get a good answer for that.
Where is the IT?